Hello everyone, we are moving on to our next topic, that is pulpotomy. Now, what is pulpotomy? It is defined as the amputation of the affected infected coronal portion of the dental pulp, preventing the vitality of the remaining pulp. In this, mainly, we are going to remove the coronal portion of the pulp. Rest radicular portion of the pulp is remained untouched so that the vitality is present. What do we do is that suppose this is a tooth and there is a caries in this much portion. What we do is we try to remove the caries as well as this much of portion. So this coronal portion of the pulp is removed, and later we will place a cotton there and see if the bleeding has arrested. Okay. Now inside with the cotton we will be placing normal saline or formocresol. If the bleeding is stopped, then the pulp in the root is not inflamed. That's why we do pulpotomy. It is done to preserve the vitality of the radicular pulp. What are the indications? Larger the pinpoint exposure of the pulp, large carious lesion that are present but are free of the radicular pulpitis, bright red hemorrhage, history of spontaneous pain, and no interradicular radiolucency. Now, pulpotomy is of two types, vital pulpotomy and non-vital pulpotomy. Vital pulpotomy includes three major steps: devitalization, preservation or minimal devitalization, and regeneration or reparative. Non-vital is mortal pulpotomy, devitalizes the remaining pulp. Let's start off with formocresol pulpotomy, which was given by Buckley in the year 1904. In this pulpotomy, we use the Buckley's formula, that is 35% formocresol, 15% glycerol, 19% formaldehyde, and 31% water. We see certain histological changes in this. So immediately after the pulpotomy is done, you will see that the pulp is fibrous and acidophilic. After 7 to 14 days, three major zones are formed. That is zone of fixation, zone of atrophy or zone of coagulation necrosis, and zone of inflammatory cells. In zone of fixation, you will see broad eosinophilic zone. Zone of atrophy or coagulation necrosis, you will see broad pale staining zone with poor cellular definitions. And in zone of inflammatory cells, you can see that it extends apically. After 1 year, the apical movement of all three zones are present and only the acidophilic zone is left. Now, what are the indications? Inflammation of coronal pulp, amputation of site is clear, and history of pain. Where is it contraindicated? In tooth in non-restorable state and necrosed pulp.